It'll be posted to our website later on today. The slides will also be on our website later today. I know that sometime through the course of the webinar today, Danny will include the link in the chat box for you all to access those slides. I'll start off with a little introduction of community solutions for those of you who aren't familiar. Then I'll turn it over to Kelsey to talk about AOF and introduce our speakers. The Center for Community Solutions is a nonprofit, nonpartisan organization that aims to improve health, social, and economic conditions through nonpartisan research, policy analysis, communications, and advocacy. You'll see there are policy priority areas really run the gamut in health and human services. So we have been very excited and grateful for you all for joining in on these webinars with us every Friday. Almost through the course of, I think, the time we've been working from home. We're grateful for our partnership with AOF and all of the really complex, critical topics we've been covering on these webinars every Friday. So I am going to turn it over to Kelsey now, and we'll see you at the end of the webinar to wrap things up. We thank you all for joining.
Great, thank you so much, Tara. And once again, good afternoon. My name is Kelsey Bergfeld. I am the Coalition Manager for Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of about 500 statewide and local health and human service policy, research, and provider organizations and advocacy organizations. So we are very excited to be here with you today, and of course, continue to take part in these webinars that really highlight the work that our members do, and especially as it relates to vulnerable populations. So today we are very excited to be joined by 4 guests, many AOF members as well. Today we'll be hearing from Soli Hernandez. She's an Associate Director with the Ohio Council of Behavioral Health and Family Service Providers. Kelly Smith, the State Program and Policy Director of the Mental Health Advocacy and Addiction Coalition, also known as the MAC. Jordan Ballinger, a policy analyst with Disability Rights Ohio, and Gail Channing Tannenbaum. She's a fantastic multi-system youth advocate doing some work with the Center for Community Solutions. So Soli, when you are ready, you can please kick us off.
All right, thank you, Kelsey. I appreciate you having us today. So I'm going to dive in on the impact of COVID-19 on behavioral health services in Ohio. So our kind of next slide goes over just some basic information about the Ohio Council of Behavioral Health and Family Service Providers in case you don't know who we are and what we do. So kind of known as the Ohio Council, and because our name is so long, but so we're a statewide trade and advocacy association representing approximately 160 private behavioral health providers across the state of Ohio. Our members provide a really broad range of services, but in the field of mental health and substance use disorders in a number of settings and to people of all ages across the state. So one of the key things that kind of we worked on fighting at the beginning of this COVID-19 pandemic is to make sure that behavioral health was really included as being seen as essential in healthcare, because behavioral health is essential to healthcare overall. Behavioral health workers really often are not seen, they're invisible first responders working out in the communities with people and don't get the same level of recognition as maybe like EMS or police. And the roles are different, certainly, but they're still out there doing some dangerous work in the field all the same. And so really a lot of what the behavioral health workforce has done in Ohio has helped prevent people from going to the emergency room unnecessarily throughout the course of the pandemic and prior to that as well. Behavioral health businesses remained open throughout the course of closures. Their essential businesses continued to provide care in their offices or clinic settings, in the community, in people's homes, and through telehealth since COVID began in Ohio. And we understand that behavioral health care is very important now and was before now, but also we do anticipate a surge in the demand for behavioral health and addiction treatment in the coming months. So typically after a natural disaster or some kind of traumatic event, you see a pretty significant uptick in the number of people seeking services. And there's often a delay after the onset of whatever the event was to when people actually seek treatment. And so since this is an ongoing kind of, disaster or event, if you will, it's hard to project or predict when exactly that uptick will happen, but we're starting to see it happen in some communities already across the state. So we do anticipate that to continue to increase over, the coming months to years even. So we've done several surveys of our members throughout the course of the pandemic just to kind of gauge impact and, what's happening with the behavioral health providers. So 100% of our providers surveyed maintained some level of services. There was kind of an idea that behavioral health wasn't open or services weren't available. So we tried to help dispel those notions and make sure that people were aware that behavioral health was open for business. 80% of our providers continued to accept new patients as well into services. So they didn't stop seeing their current clients and they didn't stop accepting in new clients. 40% of our members have maintained their regular office hours. So a number of organizations did move to a telehealth or virtual only model. And a lot of that was based on client concerns, but also staff concerns, and then depending on the type of services they provide and if it really lends to a telehealth type of modality. So unfortunately, even with that telehealth model, behavioral health providers have seen a significant revenue decline since the start of the pandemic in Ohio. So a range in kind of the revenue decline, but 20 to 50% a week was kind of where we've landed for a number of reasons. And it's important too to note that revenue for behavioral health providers directly reflects their ability to provide services. And so, people were missing appointments, canceling appointments. Appointments are shorter because it's just not the same as it is in person to do an appointment by phone. We've run into a number of challenges with telehealth with our client population because of lack of access to data packages, reliable internet, phone minutes, that kind of stuff. So that's been a challenge as well. And then unfortunately, we've had a number of behavioral health providers who have had to lay off or furlough employees at approximately 1,200 employees since the start of the pandemic. And we already had a workforce shortage for behavioral health providers. So this certainly isn't helping, especially as we're anticipating that surge I mentioned earlier. So behavioral health providers also had the difficulty that many other healthcare providers had in accessing PPE and cleaning supplies to resume the services in person at a higher level, but also just to continue providing ongoing in-person services. This is starting to be less of an issue. Unfortunately, the ongoing cost of PPE and higher levels of cleaning supplies is not something anyone anticipated. And so a few kind of important state and federal actions that were enacted to really help behavioral health providers continue to provide these much needed services to the community. At the state level, we've been very thankful for the Department of Medicaid and Mental Health and Addiction Services because they acted very quickly to enforce some regulatory changes for telehealth rules and to rapidly expand service availability through telephone only and other electronic means that aren't normally available. So they did this through emergency rules, and those current rules expire in a little over a month. And so we've made a number of recommendations to the state on how we would like to see them proceed with the emergency rules, because the pandemic hasn't gone away. Although things are opening up, we know that our clients and our staff are still scared to, go out any more than they have to interact in person, especially if they don't have adequate PPE. So it just is, I think telehealth is going to be necessary for the foreseeable future. And the other thing with telehealth is that it really has opened up services to more clients that had barriers in place, like transportation and childcare. So it's been very helpful in accessing clients in their home environment. There are a number of federal waivers in place too that really have helped with telehealth and the ability to provide services without having to do, a full deep dive and find the appropriate platform in a short amount of time. So the Department of Health and Human Services relaxed certain Medicaid, HIPAA, and other requirements so that telehealth could be provided by telephone or without a video component. There are a number of federal and state rules around telehealth that really aren't in place right now and that are allowing this more broad service to be available. The other thing is the Center for Medicare and Medicaid Services implemented a number of waivers and flexibilities for telehealth. In general, telehealth for Medicare is very limited, and not just to the type of modality of telehealth, but even to the area of the state where it can be provided and in what types of settings by providers. So those flexibilities certainly are necessary to continue telehealth. And those are in place until the federal national emergency is over. So we don't technically have an end date for that yet, although it could be up at the end of July. So we're just kind of waiting to see what we hear at the federal level for some of these waivers. But there's been advocacy to continue out the federal waivers for at least a year. The other big thing for behavioral health is that the DEA did allow prescribing through telehealth for controlled substances without an in-person exam first. So that first visit for prescribing can be done by telehealth with audio and video. And that's very important for people newly seeking services or newly being prescribed medications. And then I've mentioned a little bit of this, but some advocacy that we are working on, and that certainly if you have the platform to do so as well, and it aligns with your mission or work you're doing, to consider is at the state level, we know the budget is, it's gonna be rough for probably the next couple of years. Our major asks are really, we're not asking for new funding. We're really just hoping to sustain the current funding for Medicaid for behavioral health. If you're not kind of in the know on behavioral health and how it works with Medicaid, there was a complete system redesign a little over, about 2 years ago now. It's almost 2 years ago, 2.5 years ago, and then a carve-in to managed care almost 2 years ago. So we've had a number of huge system changes in the behavioral health field in terms of how payment works and how rates work. And so providers were really just starting to recover from those big changes, and then COVID hit. So it's kind of been really rough for behavioral health providers in terms of finances and financial planning for really the last 3 years. So our asks are pretty simple. We want to make sure that there aren't cuts to funding lines that would directly impact services. There also is some work that the Department of Medicaid is doing at the federal level with the 1115 waiver that could be beneficial for behavioral health providers and ongoing funding. And so we just ask that they continue that work and working towards behavioral health care coordination, which I realized I abbreviated that in the slides and people may not know what that is. So behavioral health care coordination is a service and it needs some structure and some work. And if you have questions about it, you can talk to me offline. I won't get into the details of it here, but it would be very beneficial for clients and providers. And then sustaining these emergency rules that I mentioned for telehealth into the foreseeable future. As I mentioned, at the national level, there are some other advocacy groups really looking for those to be extended for at least a year. The issue at the state level is that really a number of what the flexibilities the state has enacted are dependent upon what those federal waivers do. So there's kind of a gray area there if the federal waivers don't get extended. And then really just to sustain funding to the Department of Mental Health and Addiction Services, because they also fund programs for direct service providing agencies as well, but then they have the ability to directly fund providers. And so asking for those opportunities. And then talked about the federal waivers and flexibilities. And so if any of you work with other national partners and have an interest in telehealth in general, not just for behavioral health, because these federal waivers really have impacted anyone who provides telehealth services, it would be good to talk through why we need those. And if you need more details on that, I am certainly happy to talk to you. And then I think this last slide has my contact information. So yeah, feel free to email me if you have any questions about anything I covered, or if you need any more information.
Well, hi everyone. Thank you, Soli. That was really helpful. And Soli and I kind of coordinated our slides so that we could cover different things today. I'm Kelly Smith. I'm with the Mental Health and Addiction Advocacy Coalition, the MAC. We are a coalition made up of about 120 members across the state. They're mainly in Northeast and Southwest Ohio, but we also have some folks in Central Ohio. And we have a really diverse coalition made up of providers, local alcohol, drug addiction, and mental health services boards, NAMI chapters that are consumer-based groups. We have hospitals, managed care organizations. We also have courts, just to name a few of our members and give you a little bit of background about who we are. So I wanted to complement what Soli talked about and talk about how COVID-19 has been impacting behavioral health of people around Ohio. So early on, we started to think about how COVID-19, the pandemic really impacts more than just your physical health, it impacts your mental health. When the governor issued the stay-at-home order on March 23rd, it forced a lot of businesses that were not essential to close temporarily, and we know that some of them will struggle and may close permanently, and some may not even reopen. And so that's caused a couple of issues. One is around the unemployment rate. We know that it's at the highest that it's ever been at 16.8%. And there's been about 1.3 million claims that have been filed for benefits. And really at the heart of the stay-at-home order and the stay safe orders that have been issued are around safety from the spread of the virus. So to do that, the governor has been talking with us and promoting social and physical distancing. But both of those issues they're very big issues, and the pandemic has made it so that there are new and intensified stressors from people's lives, their loss of routine, separation from friends and family members. We've all been to graduation ceremonies for college students and for high school students using Zoom now. We've seen online how people are using like a parade of cars to celebrate birthdays because we can't see one another in person anymore. People have experienced loss of employment. There's been financial hardships. People really can't get through to the unemployment benefits that they've been offered. And really people are fearful of the spread of the virus. They don't want to contract it. They don't want their loved ones to contract it. They're fearful of going to the hospital and being really sick, or even of death. So this has caused increased in fear and anxiety, increased in stress due to financial problems, and increased in loneliness and depression because of social isolation, especially in older adults. So when we think about it, from two populations. The impact of people who have never experienced issues with their mental health before, and then also from people who have already had behavioral health disorders. So people who are in recovery from addiction, or people who have serious mental illness, or people who have anxiety and depression. So the next few slides, I've kind of condensed data and newspaper articles and things around the state about what's happening on the ground related to the pandemic and how it overlaps with behavioral health. The Ohio Department of Mental Health and Addiction Services reports that about 10% of Ohioans have some indicators of problem gambling. So with the casinos being shut down and sports also being shut down right now due to the pandemic, a lot of people who gamble have resorted to playing online when they're at home especially to relieve some boredom and loneliness. And when you're playing online and you might access some of those risky websites where you don't use cash, obviously, you're using probably a credit card, and you don't realize how much debt that you've actually accumulated. The Ohio Department of Commerce has shown that alcohol sales have surged over the last couple of months. They've seen an increase in how many gallons of alcohol were sold, not only to people from retail stores, but also to wholesale sales to bars and restaurants. That jumped from February to both in March. They've seen an increase, and in April. Even though restaurants and bars have kind of closed, they're still selling alcohol in increased numbers. We have also been hearing about expected increases in the ACEs scores, so the adverse childhood experiences, because of food insecurity and exposure to abuse. We know that with schools shut down and a lot of people who are authority figures who would report any abuse are not able to see kids right now, and so a lot of people are worried about exposure to abuse, and so we don't know what the future holds for ACEs scores for children. We're also thinking about it from a suicide rate standpoint. Over the years, suicide rates have increased 35% since the year 2000, and during the last economic downturn in 2008, the rate of suicide deaths increased. They doubly increased. And we also know there are studies out there that say that suicide rates are highly correlated with the unemployment rate. Recently, the Dispatch had a story where they talked about Ohio's long-term care facilities, and even Gail Channing-Tenenbaum, who I talk to on a regular basis, has told me this firsthand, that it's really hard for residents who live in nursing homes to not be able to see their loved ones. Some of them don't understand why. This has just been a really hard time for friends and family members who have friends and family members in nursing homes and long-term care facilities. And another thing to think about is, while a lot of other things are reopening, they're going to be the last to reopen because of this high-risk population and because the congregate care living situation. And then, of course, the pandemic, I saw a newspaper headline that said, I think something like an epidemic that collides with a pandemic. So we know that we've always been experiencing for the last several years an opioid epidemic, and it continues. So I just wanted to highlight a few of the counties. We don't have statewide level data because it takes about until around August or so that the numbers will come out from the Department of Health for last year's data. So it's kind of a year behind. But just to give you some data that is out there, Cuyahoga County reported that they suspect that there were 45 fatal overdoses in the first half of May. And when the governor eased the coronavirus restrictions last month, 9 people died in 2 days. Summit County reported that overdoses at emergency rooms were the lowest that they've actually been in several years, but that overdose deaths have not seen the same decline. They also reported that there were 318 visits to emergency departments throughout the county by the end of April this year, which is 100 less visits than the same period last year, and less than half the amount reported by this time in 2017. Franklin County is experiencing a crisis right now. There are so many people that are overdosing. I think it's probably, I don't know what is happening in other places that have seen high overdose spikes in the past, but Franklin County seems to be experiencing a large amount of opioid overdose deaths, including 62 people that have died in April alone. Also, I'm sorry that I didn't break this out, but Montgomery County Alcohol, Drug, and Addiction and Mental Health Services Board reported that they had a 58% increase in fatal overdoses compared to a year ago. And then I just read this yesterday that Hamilton County had 259 emergency department visits in May, which was an increase by 100 from April. So this is still going on. I know that sometimes it's not front of mind right now, but definitely the pandemic is continuing to have an effect on people who also have an addiction. So what can we take away from all of this? And Soli talked a little bit about telehealth and everything happening at the federal and state level. Telehealth has really been a saving grace at keeping people connected to care and to accessing treatment during the pandemic. And I think that this was a service that's people have always wanted to bring it online, but this was really a good opportunity because of the need. And there was a real mobilization during the pandemic to really bring it up and retool the way providers provide service delivery and care to those that they serve. And then with what Soli was saying about the state and the federal level and what they've done to relax the rules around providing care this way. So a couple of our members provided some interesting data to me this week that I could share with you all. Ohio Guidestone is a really large provider around the state. They serve about 29,000 clients each year, and they surveyed their clients, and they show that 95% of them are satisfied with telehealth services most of the time. There's also, to think about this more broadly, one of the silver linings in all of this is that some of our lawmakers are really interested in I think it's House Bill 13, and I don't follow that bill very closely, but I think it's good that we're having conversations now about internet access being available statewide. And even if it'd be great if it were moving towards being a public utility. But on the flip side of that, I know a lot of advocates are talking about the need for data and minutes and even for devices for people to be able to use, not just a phone, but maybe having a tablet at their house or a laptop. So another provider, Greater Cincinnati Behavioral Health, they're a large Southwest provider. They conducted an access survey to over 6,000 clients and found that over 40% of their clients didn't have access to audiovisual telehealth. So that's a lot of their clients. And it was because of those issues around data and technology and Wi-Fi. And they also found that actually 5% of their clients don't even have access to a phone at all times. So I guess the silver lining here is bringing telehealth online and how helpful that's been. And like Soli, we will be advocating for telehealth to continue past the emergency rule expiration in July. And then also to really think more about broadening internet access around the state and making it more accessible. And then the other silver lining in all of this is around mental health awareness. So the governor has frequently acknowledged mental health during his press conferences. He's invited Director Lori Chris to attend several of the press conferences. And I think more Ohioans are really starting to talk about their mental health because of the pandemic and thinking about how the pandemic has made them feel emotionally and what it's doing and causing in their own lives. And then I just read an article this week that Forbes had about more chain stores, including Chipotle and Starbucks and McDonald's even, that are starting to provide more mental health benefits and resources to their employees and even their family members. So there's a lot of things that the pandemic is exposing that we need to work on and we've always needed to work on, but it's bringing it to light and it's providing some more momentum around pushing for some of these things too. So we'll keep advocating with AOF. And I think the next slide has my contact information as well.
Thanks, Kelly, and thanks AOF and Center for Community Solutions for hosting us today. As Kelsey said, my name is Jordan Ballinger. I'm a policy analyst with Disability Rights Ohio. Today I'm going to cover 4 areas. I'm going to skip over a lot of the mental health stuff just because Kelly and Soli did an outstanding job in covering a lot of the issues that are impacting that system. But I'm going to be covering kind of an overview of who we are as a protection advocacy system, system capacity in Ohio, how COVID-19 has impacted that capacity, and our advocacy around rationing care guidance in the state or lack thereof for individuals with disabilities who are in hospitals receiving care for coronavirus. So as I stated, Disability Rights Ohio is the protection advocacy system. So we are state designated and federally authorized. Each state and territory has one of us. We advocate for the human, civil, and legal rights of people with disabilities. And we envision a society in which people with disabilities are full and equal members, enjoy the rights and opportunities of all people, are self-directed, make decisions about where, how, and with whom they live, learn, work, and play, and have access to needed services, supports, and are free from abuse, neglect, exploitation, and discrimination. We were actually formed out of what's known as the Developmental Disabilities Assistance and Bill of Rights Act of 1975. This was in response to Gerardo Rivera's expose on the Willowbrook State School in New York. That was just a horrifying institution that was caring for people with disabilities. And Robert F. Kennedy actually referred to the institution after a tour as a snake pit. In 1975, we were created, and then in 1986, that was expanded for our protection advocacy to include individuals with psychiatric diagnoses. I put on here deinstitutionalization because the P&As have been part of this overarching disability rights movement that has pushed for individuals to have the ability to live and work in their communities. And we have been proactive in helping support and elevate the voices of self-advocates in that overall movement. So really quickly, an overview of the DD system here in Ohio, or the Developmental Disability System in Ohio. There's really two core components to the system, which is institutional care and community-based care. Institutional care in this system is roughly around 436 ICFs, 8 developmental centers, and I'm sorry, ICFs are intermediate care facilities, and 960 nursing facilities. In the community, many individuals who are in this system rely on direct service professionals. There are around 20,000 of those in this system with an average wage of about $11. This statistic is prior to the state budget that increased that wage. However, so that is moving up and ticking up. However, there's still an issue about pay, especially with competing industries. In the DD system, there are about 93,000 individuals served, with 40,000 of those individuals on what are called home and community-based service waivers, or 1915C Medicaid waivers. And as of before the rule change in 2018, the Developmental Disabilities Council did a report on how many people are actually on this waiting list, and they estimated 49,000. Today, there are estimates that range from about 20 to 30,000 people that are still on that waiting list, but that means there are still people who are having trouble to access those services. And those services include non-medical transportation, adult day services, vocational habilitation, money management, home delivered meals, homemaker personal care, and transition services from institutions into their community. These services are delivered by a culmination of multiple different sources, so state, local county boards, local providers, and through the Medicaid program. One of the biggest things in the Medicaid program is what's known as an institutional bias. So individuals actually have a right to care in institutional settings, and the state has to apply for what I mentioned were 1915C waivers to be able to live in their community. In Ohio, we have 3 approved 1915C waivers in the DD system, which are IOs, or individual options, self, and level 1. So those help people move into their community, and states do have an obligation under the ADA, the Olmstead Supreme Court decision, to build out those systems for people with disabilities. So like I said, I'm not going to cover much, and you can go to the next slide, Kelsey. I'm not going to go over much of the mental health system. However, I will go over a few statistics for what the mental health system currently has in these 2 settings. So there are 23 residential care facilities, 6 state psych hospitals, 32 private psych hospitals, and again, 960 nursing facilities. There are roughly about 600 community providers that provide both mental health and addiction services. Of those, assertive community treatment make up about 9%, peer supports 13%, and intensive case management about 21%. Each year, this system provides supports to about 530,000 individuals. There currently is a shortage of housing in this system. This system was really created by the Mental Health Act of 1988, which pushed services into the community and out of institutional care. And in 1991, the GA did a follow-up report that said the state is not doing enough to contribute to this system. So those issues have been pervasive since it was kind of formed. In the mental health system, there is no waiver like there is in the DD system. So there is no 1915C HCBS waiver for mental health. There are currently only about 11 states that do that and 25,000 individuals served, but those kinds of waiver programs really help in establishing those HCBS systems as we see in the DD system. So for how the COVID-19 has impacted this system, there's already an issue with accessing direct service professionals in the DD system. And direct service professionals also have issues with accessing PPE. And there is a fear about how coronavirus is spread within the system, as many DSPs provide supports to multiple different individuals at any given time. So there is a need to ensure that DSPs are protected and that they are adequately funded and paid for to ensure that we are retaining this workforce in the system so that individuals receive care. Many times what we see is individuals are unable to access these services or quality services, and it forces them back into institutional care like ICFs or nursing homes, which, as many of you are aware, these congregate care settings are the most dangerous right now in the state of Ohio. It's been reported that about 70% of all deaths due to coronavirus are because of congregate care settings. So this is a huge issue, especially as there is a large waiting list for individuals to seek services in their community. If they don't have access to services, individuals most likely will choose to go into institutional care based on the fact that we haven't built out these services. So there is a need to increase transitions into the home and community-based service realm, including under the Home Choice Program and Medicaid. And there's a need for the state to identify those most at risk and provide them some intensive wraparound support so that individuals aren't at risk of placements in congregate care settings. And we need to expand that scope of services under the HCBS waivers, which would include emergency counseling, access to medical supplies and equipment, and heightened case management. Our advocacy on this issue is we've been working with DODD, we've been working with the Department of Medicaid, and we've been working with Congress and the General Assembly. Specifically around Congress, one of the biggest things that would help this system is an increased FMAP, which is the federal share of the Medicaid program. We've been advocating pretty strongly for that in the next relief package. So we continue to push for that and ensure that there is additional Medicaid dollars so that individuals are able to access home and community-based support services and supports. So how it's impacting the mental health system, as you have already heard from Kelly and Soli, it's really straining the limited capacity. And as I said, there's no 1915C HCBS waiver built into this system. It relies mostly on payments through Medicaid and private insurance. There is a need from the federal government and from the state to continue to help providers access these telehealth services or provide individuals the ability to access these telehealth services. So for instance, as Kelly mentioned, a lot of individuals don't have access to the internet, especially in our rural communities. So there's a need to ensure that those individuals, especially those at risk of institutionalization, are still being provided services either in person, or we're doing everything we can to ensure they have access to the technology to receive those telehealth services. There's also a huge issue. So in the mental health system, one of the greatest points of advocacy is referred to as housing first. It's kind of a foundation. There's a great need, and I know AOF and the Center for Community Solutions hosted a housing webinar, so I won't go too into it. But housing access is a huge issue in the state. There's like 262,000 units, shortage of units for affordable housing, and only about 4,199 safe supportive housing units in the state. So it's a huge issue. So there is a need for additional funding to go to rental assistance and preventing evictions and foreclosures for individuals. We really need to ensure individuals are able to access services in their community so they are not placed at risk of being placed into dangerous congregate care settings. Those are, as I've mentioned before, pretty dangerous right now during the coronavirus, especially looking forward into the fall. There's a potential second surge. So we really need to ensure that individuals are able to, if they so choose, move into the community and get those transitions going for those individuals. So our advocacy on this issue has also been talking with the Department of Mental Health, Congress, and the General Assembly. We've been talking about increasing the community mental health block grant so that the state mental health agency is able to provide additional support to providers. We've also talked to the GA about the need to ensure that these services in the home, in their homes and communities are expanded and provided, for that system has never been built out. And we've also been talking regularly with the department about these issues as well. So one final point of advocacy that we've been doing here at DRO since the coronavirus is working on rationing care. So thankfully, Governor DeWine and Director Acton have taken extraordinary steps to prevent a surge in the coronavirus here in the state of Ohio. However, it has still been an issue for other states, especially around rationing care protocols. So essentially what this means is when people are in the hospital and hospitals are overwhelmed, they have to consider how to and when to and where to put their medical devices for people. For instance, in the state of Alabama, they were blatantly discriminating against people with disabilities and using those, for instance, ventilators. There's been a number of lawsuits around the country, specifically in Washington as well, that talks about the issues of discrimination in rationing care. Currently, the state of Ohio does not have, at least from the Department of Health, a statewide guidance that discusses rationing care and the need to not discriminate against people with disabilities. The Ohio Hospital Association has guidance around these procedures, and DODD, ODM, and ODH kind of presented a follow-up guidance called what they titled the Standards of Care for Vulnerable Populations, which we think provides a solid foundation to protect these populations from discrimination. However, there is a need to go further. The Consortium for Citizens with Disabilities and the Office of Civil Rights and the Department of Justice have reiterated the need for states to establish these guidances and prohibit discrimination against people with disabilities when rationing care protocols are being set forth. They have stated that this does not comply with civil rights laws under the ADA or Section 504 of the Rehabilitation Act. We as DRO have been working collectively with a number of organizations around the state that range from disability to aging advocates. And we have been continuing to work with the Ohio Department of Health to ensure that some kind of guidance to local hospitals is provided, especially as we see a second surge. So sort of my parting words for everyone before I end my presentation is these systems are, everyone in Ohio is strained by these crises, but people with disabilities are disproportionately impacted by crises like the coronavirus. So it's necessary that we ensure safety and protection for these individuals and that we build out these services, these service systems, so people are protected in the long run from getting the coronavirus.
Jordan, thank you so much. Gail, whenever you are ready, you're welcome to join us.
I am ready. Can people hear me?
Yes, we can.
Good. Well, thank you to both the Center for Community Solutions and Advocates for Ohio's Future, an organization where I spent over 23 years. So it's always wonderful to see the work they continue to do. Let me apologize right up front, and it's not even an apology because I will explain it. I don't have the most up-to-date data that I would like in talking to you about multi-system youth. And the reason is, and Kelly mentioned this, I live at Westminster Thurber in assisted living, and the stress in this pandemic on the residents who live here continue to get more and more depressed, don't understand why they can't see their families. On my floor, there are 4 or 5 residents that I spend an inordinate amount of time with. And sometimes at night, I'll find them at the elevator with their coats on. And I'll say, honey, why are you up at the elevator in the middle of the night with your coat on? I'm waiting for my kids to come and take me out. And even with, we can set up a video visit, but the families are very active in most cases. And I think in terms of the pandemic, I'm learning a lot because my whole adult life has been focused on children, youth, and families. But now I'm focusing on children, youth, families, and very precious seniors. And I simply think people were very upset about a couple things the last couple days, and I spend time with those people who are very depressed residents. And we definitely have a lack of staff here, and we're not the only assisted living facility in the state that does not have exactly the same problems around staffing that is happening all over the state and all over this country. So I'll work with folks to get these materials and make them available to each of you. I'm sorry, but I'm not sorry, because we have to take care of the mental health needs of our elderly folks. Multi-system youth are children who require services from more than one child-serving system, including children's services, developmental disabilities, mental health and addiction, and juvenile justice. Each of the systems above provide services to multi-system youth and their families. And for some youth, these individual services meet their clinical needs. However, many of these youths have such complex emotional and behavioral health needs that these individual systems are not meeting their needs. 37 years ago, I worked then in Governor Celeste's office as a EA for Health and Human Services. And one day I got a note from the governor's office saying, these people from Toledo, their families from Toledo, they want to come and see the governor. And as often happens in a governor's office, the EA responsible for those areas gets the note to please meet with these families. These families' parents came down and told me an amazing story. Children in Lucas County were being then probated into adult developmental disability state institutions. We were stunned to learn how this was working, and the governor was clear that we shouldn't be doing this. So he did an executive order saying, cease and desist. No children will be probated to adult ED institutions, and at the same time, to serve these children, all of the systems I mentioned at the beginning at the local level had to get together and look at the problems that these children had, and then figure out how collectively they could provide services for these children. Well, if that did not work, then there was a group at the state level, much like our Family and Children First Council, but not nearly as sophisticated or knowing what needed to be done. And that group of clinical cabinet directors actually had a pot of money from the state that they could use to support the treatment program that the local group had proposed. And that became our first, what we called in those days, children and youth cluster. A lot has happened in the last 37 years. A lot of really good things, but there was one area that obviously needed a lot of work. And again, it was these children and youth and their families who sometimes the families simply could not provide services for their child. So imagine you've taken out a second mortgage on your house, you sold one of your cars even though both of the parents are working to get money to be able to provide for the treatment needs of their child. Finally, after a couple years, they simply do not have the financial means to continue to pay for these services. These services at that time were not accessible with respect to Medicaid, because that income line could be over 200% of poverty. In July of 2019, Governor Mike DeWine signed House Bill 166 and created $50 million over 2 years to the Ohio Department of Job and Family Services to assist with children in custody of a public children's services agency that requires services from multiple systems or to prevent children from entering the custody of a PCSA. And I'm assuming that most of the people that we're talking with know what custody relinquishment is, but briefly, it means if the family is at that point and has no more resources to pay for outpatient and often residential treatment for these children and youth, they can go to court, and the court will take custody of their child and give custody to the County Child Protection Agency. They have to give up custody of their child. No abuse, no neglect, And in fact, they've done everything they can for the health and mental health of their child or any other of these system needs, and they just at a certain point are not able to do it anymore. They haven't abused or neglected these children or youth. They simply need help. And so the Department of Mental Health and Addiction Services and Medicaid looked at this issue and our need to help find money to work with these families through Family and Children First and come up with appropriate treatment plans that we can now use to pay for the agreed upon treatment plan through the local Family and Children First Council. And then there is an application, and after the application through the local Family and Children First Council comes to the state council made up of clinical people from the state departments. They approve the applications, and these youth get services to prevent custody relinquishment, or if they've already gone through the process of custody relinquishment, they
Gail, I'm sorry to interrupt. This is Tara. I wanted to just jump in really quickly because I see that we're about to run out of time in our hour because we just had so much to cover. I wondered if you could just really quickly focus on how this group at the state is reviewing these applications and how they've adapted in the pandemic, how these dollars are still getting out the door to help communities and families in the midst of COVID.
Sure, Tara. They, the reason I was really happy to do this, because at this time, during the pandemic, every week there is a group of folks who make up the Family and Children First Council at the state level. They review the applications, and since October 1 of last year, they have now provided support and services for all 88 counties, and through this process, they have provided, during the pandemic, they have continued to review applications, provide technical assistance to the counties, and have funded treatment programs for 186 children and youth. And we were figuring out earlier today, approximately 86 of those applications that were accepted happened since the pandemic. So we're pretty pleased that in the process of the pandemic, and we are seeing a lot of youth with mental health needs as well as other needs of other departments, but we feel very good that we've been able to provide the funds for these families, where possible, to provide home and community-based services. And to date, we have spent $4,243,900 $4,243,582. So I think we clearly think this is money well spent. Our advocacy for the rest of 2020 and for 22 and 23 will be trying to hold on the funds we have for the rest of 2020 when it starts July 1, and then to see if we can't also hold on to that money in 2021. In the piece that we'll send over, I did want to let you know who our champions, besides Governor DeWine, and have been, and who our legislative champions have been on both sides of the House to make this all possible and to understand for this purpose they want to eliminate the use of custody relinquishment or reversing custody relinquishment back to the custody of the parents.
Thank you, Gail. This is Tara. We still have work to do in this space. So hopefully in the future we'll be able to provide another update to you all on this work that we've been doing on multi-system youth. It's a little after 2. Thank you all for sticking with us. We had, like I said, a lot to cover, and we really appreciate all of your attendance at all of these. Next week we will be focusing on older adults in mostly home and community-based settings, and then also kind of exploring what has been happening in adult protective services in the last few months. I know we talked about that kind of child welfare piece a few weeks back, so we're going to focus more on adult protective services next week. So I wanted to thank you all again. Thank you to the panelists, Jordan, Kelly, Soli, and Gail. Thank you, Casey and Danny, for helping keep us organized through this webinar today. We will be sending out any questions that we didn't get to answer to our panelists to see if they have responses to them and get those sent back around to all of the attendees. Reminder that the slides will be on our website right after we're done here today, and then follow-up information will be posted as well. Thank you all again for attending, and we will see you in the coming weeks. Thanks.